Hello everyone, welcome to another beautiful, amazing session, and I'm your favorite host, Nyambura Kamau. This is the Health Hub Show, but before we delve in or our today's topic, I want to remind you, are you there and ready to build up? You don't have a plan? Or do you have an idea that you want to turn into reality? Oh yes, DreamWorks, our sponsors, they are here just to fulfill your dreams and turn them into a reality. So just follow up or get their contact. DreamWorks Investment Limited, they are your best partners. So karibu sana. I hope you're fine and okay this evening. So karibu sana. This is the Health Hub Show, and I would like for you to introduce yourself to our audience.
I go by the name Omar Yusuf. I'm a medic working in the private and public sectors.
Nice to know you. So today we have a very sensitive topic, and it's about managing responsiveness. But before we go that, can you define to us what is responsiveness and unresponsiveness?
Unresponsiveness is where a person loses consciousness. In responsiveness, it's where the person has full information of where he is.
Okay. So what are the first signs you look for when someone is unresponsive or responsive?
When a person is unresponsive, we use the scale AVPU, where it stands for alert, voice, and pain. So if this person is not responding to those alert, voice, and pain, we categorize this patient as unresponsive.
So what circumstances can lead to unresponsiveness?
For instance, maybe somebody has undergone a traumatic injury to the brain, diabetes when the person has low blood sugars,
Okay.
yeah, and some medical conditions.
Some medical conditions.
Yeah.
So they can lead to someone being unresponsive.
Yeah.
Okay, when it comes to unresponsive, okay, vividly, without that heavy language. Ni kama kufaint ama ni how?
In unresponsiveness, it's categorized into two parts. There is unresponsiveness where a person is breathing, and there is unresponsiveness where that person is not breathing and has no pulse. Yeah.
So simply, so that means that fainting ama losing conscience, see the same unresponsiveness.
It is the same as unresponsiveness, yeah, fainting. But fainting, it takes a period of maybe 2 minutes, and that person becomes conscious again. No. So I will not categorize that as an unresponsive person.
Oh, so if an accident occurs, ama if someone tends to be in that situation, how do you assess it?
If a person is unresponsive, we first check for the airway. If the airway is open and we maintain the airway, we check for the breathing. In breathing, we assess if there is a rise and fall of the chest, as well as the abdomen, and as well as circulation, whereby we check for the pulse, either the carotid pulse or the wrist pulse.
So, okay, let's assume someone has had an incident, an accident in my presence, and I don't know how to read the pulse or check. How should I do it?
Okay, when assessing for the airway, breathing, in simple term, we use look, feel, you observe. While you're looking, you just look for the rise and fall of the chest. Okay. When you feel for the air if it's coming in and out, when you're passing it through the nose of that person. Mm-hmm. So if you know this person is unresponsive or responsive.
Okay, so can you give us the key differences between unresponsiveness and altered mental status?
Unresponsiveness is where this person totally loses consciousness. In an altered mental status, which is where this person is responsive but disoriented. For example, if you ask this person where he or she is, he doesn't know. In simple terms, in altered mental status, he's disoriented.
Disoriented is a very broad one.
Okay. In my term, to classify somebody as altered mental status, I ask 4 questions.
Okay.
I ask his name or her name, where he is or she is, what is the time, and what happened. Or is he, he is aware of his surrounding. If this person answers 4 questions, then this person is right. If this person doesn't answer, or maybe he answers 2, this person has altered mental status because it seems he or she may be confused.
Oh, okay. So, if something happens, what immediate steps should one take?
Uh, According to first aid, when somebody loses consciousness or maybe unresponsive, he may take this person to where there is fresh air and loosen any tight things like belts, ties, t-shirts, and then put him in a recovery position. I know most of the people, when somebody may lose consciousness, they tend to prepare using a book.
Oh, yeah, it's
Yeah,
very common.
yeah, but that's not advised.
So, okay, first of all, tunafaa tumchange location yenye ako ama we work with that person akiwa kwa hii situation wherever they are.
If that person had undergo any trauma, you move that person to a place where there is a fresh air.
Okay.
If that person has undergone some trauma accident, do not move that person because in any case we suspect a spinal injury.
A spinal injury. I think that's a different topic to handle.
Yeah, that's a different.
How do you ensure that person, let's say we have moved that person, how do you ensure they are breathe out equal clear, like the path?
Okay, when assessing for the airway, we check for if there is any secretion such as vomit or saliva that may tend to block the airway.
Okay.
In some cases, the tongue may even fall back when a person is unresponsive. This may cause the airway pathway to be compromised.
Okay.
And also, if somebody has undergone some trauma, like maybe ngumi, the trachea, it may deviate. So it may compromise the airway. So while assessing for the airway, you ensure that the airway is open and intact.
Okay. One more question. Does the positioning of how you handle your patient matter when it comes to breathing?
Yeah, actually it matters. That's an important key when handling an unresponsive patient. Like, let's say, for instance, when a person has just regained conscious, we advocate this person to be put in a recovery position.
Okay.
Yeah, and in some cases where this person is unresponsive, we advocate that this person should be laid down.
Lay down.
Yeah.
Do we have a specific side? Because I observed when it comes to pregnant women, and if they are unconscious, we use the left side.
Yeah. You see, for pregnant women, it's more advised to put her on her left side because if you put on her right side, there is a main vein. Yeah. We prevent that the fetus it doesn't lie on it on that vein.
Okay.
Yeah. So when that fetus lie on that vein, it may cause blood supply to be insufficient.
I discovered not only pregnant women. Someone once told me, I don't know whether it's right or wrong, that if it's a lady, as long as it's a lady, you place them on the left side. Don't make an assumption they are not pregnant or they are pregnant.
Yeah, actually, in my field, we assume that every girl is pregnant.
Oh, okay.
Yeah, so we put this person on it. If it's a girl, we put this person on her left side.
I also observed sometimes when you place them, you lift their legs. I don't know whether that's the recovery position.
In putting a person in a recovery position, it's basically just putting him or her on her side. Raising feet is just to increase blood supply to the brain.
Okay.
And this is more important to the people who are unresponsive, where I say they lie on their back, and then you raise their legs, you elevate their legs.
So the elevating of the legs is totally like it does not affect the breathing.
I know it doesn't.
Oh, okay, that is curious, very curious for me because I always wondered kila mtu akipaint hata kama ni shule. The first thing ni kumuinua miguu. The second thing ni kumpepetea ama kumtafutia kivuli.
Yeah.
So it's most of them ama ni mix gani imepata kulingana na situation?
Okay, most of the cases in our homes, yeah, mtu they faint, they tend to kumpepea, ama sometimes wanajaribu yeah, you get that instance. But what we advocate is we raise the patient's leg above the heart level so that there is more blood supply going to the brain.
Also, before we head too far, kuna hii ya mouth to mouth. I don't know how it actually occurs or when it's specifically needed. So I would like for you to elaborate us on that. But before we get to that, I want to remind you again, don't live in a shabby house. And once more, usikubali kuwaste pesa yako on an unplanned house management ama on an unplanned building. Live in the best of the buildings and make observations like ukihitaji design, ukihitaji plan. DreamWorks Investment Limited, they are just here for you and they are the company you need. We are going for a short break and we will be back.